Sabota, welcome to medical science class. As a student of medical science, I wanted to take flavor every branch of science. What kind of things said, that is birth, that is knowledge, that is dressing, that is good work, that is honor. As a Muslim, Allah is the one and only creator except Allah, all creation, last time, best messenger Muhammad. La ilaha illallah Muhammad Rasulullah. Now my friend support how much one cup. Ya Ali Lam Lam Hayya Allah Shafi Allah Mafi Allah Kafi. Ana Abdul Muhammad Shuri Shafi Mafi Kafi. Now my friend supporter, we discover about heart disease. Heart common disease. We discuss about heart disease. Also discover about main theme of heart transplant. Now heart disease. Now how control your BP, blood pressure. In case of blood pressure, your blood pressure is remain BP, blood pressure. Adult pulse remains 70 beats per minute. How you understand that your heart is work good? In case of adult pulse remain equal more or less 70 beats per minute, and your blood pressure 122, diastolic pressure 80, systolic pressure 120, below pressure 80, up pressure 120. Difference between diastolic and systolic pressure: up pressure is called systolic pressure, below pressure is called diastolic pressure. Difference 40, not 40, 40. 120 minus 80 equal to 40. 110 minus 70 equal to 40. 100 minus 60 equal to 40. That is the value in case of blood pressure. You remain and pulse equal more or less 70 beats per minute. If anything wrong, you know that there is a problem in heart. That is the sign of how you understand the heart is not work good. By that pulse and BP, you can understand that your heart is not work good. If that remain range, what I say, and pulse equal above 70 beats per minute, and systolic and diastolic pressure and remain difference 40, your heart remain good. But if not work properly, your heart not remain good. Now in case of heart disease, you feel the pain in chest, pectoral region, which area occupied by the heart. That region you feel the pain and chest pain, left sided chest pain, and if radiated to tip of the left shoulder, also left neck. That is the, by that symptom you identify that the heart, chest pain or heart pain, heart related pain. If you feel that pain, what is the reason? Also you feel the breathlessness. In case of lung disease, asthma disease, you feel that. In case of heart disease, you feel breathlessness. When heart blood circulation, nutrition, oxygen reduce, first heart try to more beat, tachycardia, more than 100 beats per minute. That is term is called tachycardia. When heart fuel is not found, then try to stop. Then below the 60. When heart rate go to the below the 60, you know that is bradycardia. This term is called. When heart below the 60 and below the 50, you go to the hospital. There is a chance of develop heart failure. Those are my patient. If heartbeat below the 50, there is a chance of heart failure. go to the as soon as possible hospital, and what is the reason, try to do that, and, and consult with cardiologist, what is the reason and what is the problem, and find out the solution. In case of heart disease, you understand that. Now, in case of that also, what is the hot symptom I say? Hot symptom and hot symptom I say, if you feel that, don't late, go to the hospital, nearest hospital and nearest cardiologist, or cardiologist is not present, consult with the doctor. What is the treatment of cardiogenic shock? If your heart rate is below 50 and that is the cause of heart, what is the cardiogenic shock management? Treat the cause. If heart rate is below the 40, there is a block in coronary artery. The cause is cause is first, coronary artery blood supply increase. What is that? Antiplatelet drug. Then natural heparin increase the blood. But natural heparin, antiplatelet drug, it is not cure, come in not vital sign is not come in normal range. Then necessary to angioplasty. You see, do the angiogram, echocardiogram, and echocardiogram show the heart valve ejection fraction and how heart work. And echocardiogram, angiogram, see the your heart in artery in heart there is a block present or not. In case of ECG found normal. In case of that case, ECG found abnormal ECG. In case of MI, T inversion. In case of old MI, Q prolonged Q wave. By that ECG, you can understand that MI myocardial infarction or not. Okay, fine. And that is the reason you go to the nearest hospital as soon as possible and check the do ECG. What is the situation of the heart? By ECG, you can understand. Then doctor said to echocardiogram or angiogram. By angiogram, you arterial condition of the heart, you see there is block present or not, and angioplasty necessary or not, or bypass surgery necessary or not. And in that severe condition, when give antiplatelet drug and natural heparin, that is not cure, then go to the angioplasty. If there is a block, 90% or more block, that is not correct by heparin antiplatelet drug, then angioplasty, angiogram, which is artery block, then there is a stent, explain the artery and blood. But if more than one artery block, and that is the chance of bypass surgery. And right coronary artery, left coronary artery, both have problem. Now angioplasty, now need to bypass surgery. What is the bypass surgery? From ascending aorta, additional vein or vein, artery can be used, but usually vein is used. Excessive vein from body take, and from ascending aorta there is a connect to the artery. Which artery block? Which portion block? Not found the heart circulation or blood. Other portion connect to the other portion where myocardial infarction occur. Above that and heart blood circulation found and heart. If it prolong, continue that, there is a severe damage of the heart muscle, especially visceral pericardium, myocardium, endocardium, especially upper layer, visceral pericardium, that layer. And if that pericardium necrose, then that start to survive in that condition. But there is a solution also. And heart muscle also tonicity. Heart muscle can be pumped. SA node, AB node, atrioventricular SA node, sinoatrial node, AB node, atrioventricular node, AB bundle of his Purkinje fiber. Heart muscle also have the capability of pumping. Don't worry. Fine. Now that is the exclusion. That is the conclusion is how you understand to you have suffered the heart disease by CU pass and blood pressure and symptom what I say. You see that if you find that, go to the doctor. And how the treatment of cardiogenic shock. In case of cardiogenic shock, if heart rate below the 40, there is a atropine. Below the 50, atropine. Below the 40, there is a adrenaline. Adrenaline is the drug of choice. But in case of adrenaline, heart rate more pump. But the problem is artery block. If heart more pump, maybe supply, but there is a chance of rupture of coronary artery. Already coronary artery block, then treat the cause. Antiplatelet drug, then natural heparin, then adrenaline. How much heart supply, blood supply found? If that blood supply found properly, then adrenaline, treatment of choice. But if you give sometime adrenaline, patient die, already 2 coronary artery, 90% or more block. If the adrenaline, that is the reason for first antiplatelet drug, then have natural heparin, then you try for adrenaline. Why adrenaline? That is the reason. Understand? I think better. Today is enough from Medical Science Labs. I am representative of Dr. Mohammed Shulji, Dr. Sohel. Dr. Sohel. Those are known as me, Dr. Sohel or Bro Sohel, Brother Sohel. Except my profession, Bro Sohel, Brother Sohel. There is a profession of it, Dr. Sohel. Now understand that. Today is enough from Medical Science lecture. Thank you very much, my friend.